Welcome to the Caregiver Cloud course on coping with combative or inappropriate behavior. This course can apply to patients in facilities or in home health situations. Patients with dementia or developmental delays may exhibit inappropriate behavior or become combative when they are confused or feel confronted. In order to prevent such situations from escalating, the care provider should learn how to calm the patient and redirect their mental focus. For example, the caregiver is giving a bath to an elderly dementia patient and the patient becomes combative. The caregiver should back away and talk to the patient in a clear, calm voice. A dementia patient may return to a cooperative state when given some space and reoriented to the time and place. Explaining to the patient that you are assisting with bathing and that you mean them no harm will sometimes work to calm the patient and allow the bath to be continued normally. The caregiver cannot apply restraints without an order. If the caregiver doesn't complete the bathing of the patient has not received proper care. A caregiver who holds a patient down for bathing is committing a crime, so never take this approach. If the patient cannot be calmed and continues to refuse to bathe, notify your supervisor. The caregiver knows that dementia patients may suddenly become combative. Patients with dementia can misinterpret or misunderstand care actions and become fearful or angry. When this happens, the patient may strike out at the caregiver. For example, giving pericare to a patient's private parts might be considered sexual assault in the mind of the patient. Dementia patients are not always combative, and complex explanations will sometimes only confuse them further. Dementia patients can be calm, but are not easily distracted when in fear. The caregiver knows that the best way to keep a patient calm is to explain each step of what you are going to do in simple terms. The best way to keep a patient calm is to keep them from becoming fearful or misunderstanding your intent when giving care. Use an unhurried approach and explain each step of what you are doing in simple terms while you work. Stay pleasant and non-threatening. Talk to the patient while you get their care underway, telling them what you are preparing to do and that there is no reason to be afraid. Do not hurry through the process, as quick motions can alarm patients and cause a flight or fight response. The appropriate response of the caregiver when a patient makes a sexual advance is to step back and calmly tell the patient that their action is not appropriate. Many patients do not realize who you are or are in a dementia phase and don't know where they are or what they are doing. Try to reorient the patient to the current time and place and tell them who you are and why you are there. Do not threaten the patient with the police or strike out verbally at the patient. Do report the patient's actions to your supervisor, but this is not sexual harassment. This is a symptom of their mental health. The caregiver knows that the sudden onset of combativeness must be reported immediately because it is a sign that the patient's condition has changed. A patient who has not been combative in the past may have a change in condition that is causing the reaction. For example, the first sign of decreased oxygenation to the brain is irritability. This can be caused by decreased lung function as in pneumonia or one of the first symptoms of a stroke. The supervisor must be notified of the patient's actions right away. Neither dementia nor Alzheimer's is a sudden onset disorder. Both are slowly advancing disorders. Combativeness can also be a sign that abuse has occurred, but is most often a sign that the patient's condition has changed in some way that is affecting the brain, if they have not had this problem before. A nurse professional or doctor should do an assessment for other signs such as infection, disorders, or disease processes. The caregiver should know that a patient with a sad demeanor is giving a nonverbal cue indicating that they are possibly about to become hostile. Nonverbal communication is a tool that should be familiar to all healthcare workers. A patient who is rapidly looking around, has clenched fists, and a clenched mouth with teeth grinding is giving indications that they might be about to lash out and are going into the fight or flight phase. The caregiver should step back and try talking calmly to the patient when they seem agitated. Explain what care efforts are happening or ask the patient why they seem upset. Other patient agitation signs for a caregiver to watch for include a red face, the flailing of arms or hands, hostile speech, or other sounds like growling. After a patient's hostility situation becomes resolved, the caregiver should try to pinpoint what caused the patient's agitation. If caregivers can determine what caused a patient's hostility, they have a much better chance of resolving future occurrences. Many times, patients are reacting to something they have seen or heard, or a fear that something bad is going to happen. For example, a patient who was previously in a tornado may fight to get out of the building where they are being given care if they hear a crash in the hallway, or a patient who has been a prior victim of rape may become hard to manage during peri-care. In the mind of the patient being cared for, even if triggering events happened years ago, such triggers can make it seem that the same events are happening again in the present time. The patient must always be cared for, and it is not appropriate for the caregiver to ask to not have to care for the patient, nor is it appropriate to ask the patient for an apology. Dementia patients should always be approached with a relaxed and cheerful demeanor. This is especially important because dementia patients pick up on emotions and attitudes from people around them. If the caregiver is stressed, the patient may pick up on that and become stressed and fearful. A caregiver needs to be able to leave their stressors at home and present a relaxed, calm, cheerful demeanor while giving care to patients. An overly professional, matter-of-fact, or no-nonsense attitude can seem uncaring or even bossy or aggressive to dementia patients. On the other extreme, a caregiver seeming meek can be construed as weakness, which the patient may try to take advantage of. If caring for a patient in a facility, one way to calm a patient is to divert their attention to a memory box from home. A memory box with pictures and trinkets from home may bring back pleasant memories and give the patient something happy to talk about. It is also helpful to place family pictures and mementos around the room within the patient's line of sight. If the patient begins to seem agitated, the caregiver can always draw attention to a picture with a comment like, "You have such a beautiful daughter." Trying to take an agitated patient outside may cause increased agitation, may invite them to attempt to run away, and can cause dangerous falls. Staying on a familiar routine as a caregiver will help keep your patient from getting aggravated. Keeping a patient on a routine cuts down on frustration and confusion because they know what to expect next in their day. For example, a patient may become frustrated and even combative when their breakfast is late, not because they are hungry, but because their expected routine has been disrupted. A dementia patient may have fearful thoughts such as being left to starve, that no caregivers are coming, or just wondering what terrible thing might have happened to cause the lateness. Being dependent on the actions of others is scary, and a disruption in routine to a confused patient can be terrifying. Physical pain, frustration, and too much sensory stimulation can also cause agitation in patients. This concludes the Caregiver Cloud course on coping with combative or inappropriate behavior. Copyright 2016, all rights reserved, Caregiver Cloud, LLC.